By now, it should be clear to all observers that politicians, public health officials, nonprofit health groups, and the national media are joined in common cause to force Health Canada into abject retreat on vaping. The end game is a complete policy reversal on the regulations allowing adult access and choice to vaping products in Canada. But more than just a U-turn, opponents appear to be demanding from Health Canada an admission that the agency concerning the science on vaping got it wrong and miscalculated the health risks, the impacts of flavors on youth use, and the hazards of nicotine. The pressure campaign is in full swing behind the scenes in Ottawa and supported by legislatures and public health groups from across the country. It's fully out in the open now, propagated by activists in the media, such as Kelly Crow from the CBC and Carly Weeks at the Globe and Mail, to name just a few. In this edition of RegWatch, we are joined by David SWEANOR, Ottawa lawyer and renowned tobacco control policy expert and harm reduction advocate. And we're going to dive right into the issues with David. David, thank you so much for joining us today on RegWatch.
Great to be with you again.
And it sure looks like the political pressure on Health Canada is, turned up to full steam. What's your thought on that?
You've got media that's acting like tabloid journalism, incredibly biased coverage, no even effort to think about balance, let alone give balance. So they've given carte blanche to abstinence-only people. They're handing out misinformation. They're missing the point of what's this really about. We're dealing with something that's killing 20,000 people a day globally, cigarette smoking. We're dealing with something that's killing, about 40,000 Canadians this year. Over 100 Canadians today will die because of cigarette smoking. Cigarettes are an incredibly deadly delivery system, an incredibly toxic way to get nicotine, which itself has very few risks.
I think that every single person in public health that is participating in this hysteria has abdicated any ounce that they could say that they're in this for any kind of health effects at all. Even while we're trying to protect the children. Well, I mean, let's find out what you think on that. I don't even think that they're trying to protect the children is really about health. This is about control.
Well, this might sound trite or old-fashioned, Brent, but truth matters. And when people put an ideology above facts, above science, above humanism, that's worrisome. And what we're seeing now, there's many people commenting on it, is the death of truth. People putting ideology ahead, choosing their own facts, misleading people for whatever reasons that they've got. So there are ideologies in play here, Brent. I find it disturbing, but we've always known in this field that about half the people, and we talked about this back in the 80s and 90s, about half the people attracted to doing tobacco control were actually not public health oriented. They were moralists, they were prohibitionists. Right. And it's just, they are getting a lot of voice right now, and they are dragon slayers. They're on a quest. They really think they're doing the right thing. They're doing God's work. They're going to get rid of this terrible drug, or they think that they're attacking the cigarette companies or tobacco companies or vaping companies or capitalism. And they're losing sight of the human beings who are really at issue here.
Right. Well, if you're a collectivist thinker in nature, you don't really care about individuals. That's just the way it works, right? Progressives look at the whole issue. They'll accept individuals as a part of society, but they believe that society comes prior to the individual. And if you believe that society is prior to the individual, then it leaves a whole host of room to make rules and decisions and so forth for the good of the common weal, as opposed to the good of the individual. And a government and a collective shouldn't be making decisions that are based on the good of an individual either. Individuals are supposed to make those decisions for themselves.
Yeah, well, you're talking a lot about what we saw with people like Stalin and in his idea of remaking mankind. I don't really know the full motivations of some of the people who are doing this, in part because they're not only feeling that they have to go out and slay this dragon, they refuse to talk about it. So if I say, what you're doing looks to me to be really counterproductive. Let me show you some evidence on that. Let's talk about it. Yeah, heck, maybe I'm wrong and you're right. Like, let's sit down and talk. That's what the Enlightenment's all about. That's what science is supposed to do. That's how we come up with better policy. And the answer is no, I will not talk about it. It's acting like they're members of a cult. And these are people I've known for a long time. I mean, decades in some cases. And this sort of, it's an abrogation of what should be their responsibility to society. I mean, they're in a position where they can influence things. There are literally lives in their hands, and they choose to do something that I think is objectively counterproductive if what they're trying to do is save lives. They're misleading people. There is no ethical basis for misleading people, for telling lies. And yet they won't even talk about it. And they're shaping policy. They've got the ears of, journalists who should know better. This combination of activists who haven't really thought through what they're doing, as far as I can tell, or they're doing it for some unjustifiable reason, dealing with reporters who have forgotten how to be journalists. They're not looking for balance. They're not questioning. They're putting out incredibly biased information that, to the extent that the public still believes this media has credibility, is going to result in deaths.
So I've just thrown up here the CBC series, and this is very concerning. What we have here is the nation's public broadcaster, funded by taxpayers, funded by vapors, too as well, have launched the Vape Fail series. Now, this is obviously after now what has been almost 24 straight months of sheer one-sided propaganda, starting with, the epidemic. This is the kickoff here with Mark Harrison, but this is a Kelly Crow kind of branded series, and it's called Vape Fail. The hope of vaping as a safer alternative to smoking is fading. We explore why. What does that say to you, that headline of this intro?
We need better journalism schools, apparently, and somebody needs to remind the CBC that they've got social obligations. They're not a propaganda tool. They're supposed to be informing Canadians, not misleading Canadians. Balance is actually really important. So, feel free to go out and interview people who have an abstinence-only view or misinterpret or misstate the science, or just have a different view of the science. But for heaven's sakes, talk to the other people, the people who have actually done more of the research, the people who have spent more time looking at this, the people who can put that into perspective. Because don't you owe it to the Canadian public to do something like that? Like, the pressure they're trying to put on Health Canada to do dumb stuff, when Health Canada's tasked with a very important job. I mean, they're supposed to be trying to protect the health of Canadians. And you get this broadside of misinformation and fear-mongering, quoting a lot of people whose work has been thoroughly disputed by reputable people without even going to the reputable people to ask. You have people who are attacking things out of, say, Public Health England. Have they asked anybody in Public Health England? How do they respond? Have they asked anybody at the Royal College of Physicians, the British Medical Association, Cancer Research UK, Action on Smoking and Health in the UK? Not at all. They just do these attacks. So, it's a huge concern, because media is so important for a functioning democracy, to have faith that we're getting valid information. And we've seen, as Robert Reich was talking about in The Guardian yesterday, and recent Pew research out of the US, the faith in media has crashed from a time in the 1970s where over 70% of Americans, at least, believed that they could trust the media very much, to about 18% now.
So it's not just the media, though, however, just to add, because I'd like to direct you to specifically talk about the CDC, the Centers for Disease Control in the U.S. You've gone, worldwide, that this particular regulator leads worldwide. Yeah. How would you characterize its truthiness with regards to confounding illicit THC vaping with nicotine vaping?
There are too many really bright, highly educated people at the CDC to merely say they're stupid. It's worse than that, Brent. They have been anti-e-cigarette. They have been anti any alternative to cigarettes. They have put out tremendous propaganda about Swedish snus, about moist snuff, products that are undoubtedly much less hazardous than cigarettes. You will not find them saying anything about relative risk on these products. They're just scaring people. They've been doing it for a long time. And again, they were charged with a really important task in trying to protect the health of Americans. And they've abandoned that for whatever ideological reasons they have in pursuit of this tobacco-free world. It's an abstinence-only agenda. And again, we need credible institutions of government.
Here with Kelly Crow's piece, and this is how she's starting it, and it's with a lie, right? The
Yes.
first thing, yeah, it's a lie. Yeah.
Well, that's what happens when you don't do real journalism. I mean, the idea of getting another view of something. I think, if I called Kelly Crow and said, I just found out Mars is going to crash into Earth next Tuesday, I would think she'd probably go and ask somebody else whether Sweenor's right on this. Rather than
David, I think you're looking at this in the pre-totalitarian outlook. The pre-totalitarian outlook is going, she's not being a very good journalist. A public health advocate that's trying to kill vaping looks at that and goes, she's being an excellent journalist.
Well, she's being an excellent propagandist. But
That's
if you
right.
look, what's the role of the CBC? Should they be doing that? You read that and say, so she's saying people said it was safer, and it turns out that's not true? Well, I mean, to claim that vaping is not safer than smoking cigarettes, is like saying, no, Mars is going to crash into the Earth tomorrow. I mean, it's nonsense. It's just anybody who's got even a really basic grasp of the science can figure this out. And we need to repeat, I mean, some of the people who are pushing this nonsense worked doing things to reduce cigarette smoking in the past. They need to remember why. How many people die from cigarette smoking and why? Such a huge number of people that it will kill between half and 2/3 of long-term smokers because of the inhalation of smoke. And this is something that's been perpetuated by an industry and by the people who have been protecting that industry. And the abstinence-only people protect the cigarette industry. Why would we want to do that? Why would they want to do that? Don't they have any social networks? They must know people who have died from cigarette smoking. Have they never sat there in a hospice holding the hand of somebody who's dying at age 49 because of their cigarette smoking? How could they do that and still think this is an ideological quest, or that it's okay to distort things, or if I can force Health Canada to do something that goes against the interest of Canadians, that long-term will be seen as way worse than the blood scandal, but I win. That's what I want to do. I mean, that is really, Brent, when we start getting that sort of stuff happening, by people who should be doing public health, that's a huge problem. When we've got media that doesn't want to get balance, they want scare stories, they want clicks, we're destroying the faith in these people. And we've seen where that takes politics in general, when people stop believing the people that actually should have been telling them the truth, should have been informing rather than deceiving them. When she's working for the Canadian Broadcasting Corporation, funded by taxpayers with a lot of money to try to inform Canadians, what she did is just simply wrong. And to the extent that she succeeds in creating more fear, we see what I'm seeing now in looking at the data. We're seeing a resurgence in smoking as people who had switched to vaping are switching back to cigarettes because they've been scared. And they've been scared because of that sort of tabloid journalism. And if it was coming from a blogger, I'd still be upset. When it comes from the Canadian Broadcasting Corporation or the Globe and Mail, that is really disturbing. Those used to be really credible news sources. I think they still are on a lot of. I'm a fan of both of them, and I'm a reader, a follower. But it really disturbs me to be seeing some of that coverage and thinking, well, yeah, maybe I know enough nuance on this to say, I know they're misleading me on some stuff and I can ignore that, but I'll trust them on other things. Can we expect the public to say that?
No,
as you start to learn that what they're doing is misleading. It's simply factually incorrect. It's not balanced. And to the extent that it's believed it's going to cause harm, that looks more like a fraud than good journalism.
They clearly are incapable of bringing any perspective of fairness to this issue. And the only organization that could lead the CBC into taking fairness on the issue is Health Canada. There's no other organization in the country that's able to do that.
We have to count on Health Canada and the Minister of Health to be able to stand up in the face of what's really, call it what it is. It's bullying. It's trying to force them to do something that's not in the interest of Canadians. And I've got great sympathy for the people at Health Canada who are trying to adhere to the science. They're trying to look at facts. They're looking at what's happening with consumers. They're doing research to find out how can we improve the legislation we've got? How do we deal with the regulatory powers that we've been granted in order to try to refine this, to reduce the risks that are associated with any new product while getting the benefits, getting rid of cigarettes. So there's this tremendous opportunity. And it's got to be heartbreaking for them to see all this pressure for them to abandon that.